Good morning, everyone. I'm Dave of Stage 5 Kidney Failure. Welcome to my kidney journey. This morning, I'll be reading a summary of Category 2 Acute Kidney Injury. Acute kidney injury, formerly known as acute renal failure, is a sudden rapid decline in kidney function. It occurs over a short period, typically hours to a few days, leading to the accumulation of nitrogenous waste products like urea and creatinine in the blood and a breakdown in the body's fluids, electrolyte, and acid-base balance. Unlike chronic kidney disease, which is a slow, progressive, and permanent loss of function, acute kidney injury is often reversible if caught and treated early. However, it is a serious medical condition that significantly increases the risk of developing into chronic kidney disease or end-stage renal disease. Causes and classifications. Physicians categorize the causes of acute kidney injury into three distinct physiological zones depending on where the disruption occurs. Identifying the category is the first step in directing treatment. Here are the classifications and causes. First, pre-renal acute kidney injury, 60 to 70% of cases. The kidneys themselves are healthy, but they are not receiving enough blood flow to filter out waste products. Volume depletion, dehydration, severe bleeding, excessive vomiting, diarrhea, or burns. Cardiovascular failure, severe heart failure, cardiogenic shock, or myocardial infarction, a heart attack, reducing cardiac output. Systemic vasodilation, sepsis, or anaphylaxis, severe allergic reaction causing blood pressure to drop dramatically. Medications like ibuprofen, which constrict the afferent arteriole, feeding the kidney, and ACE inhibitors and ARBs, which dilate the efferent arteriole, lowering the blood pressure inside the filtration unit. Second, intrinsic renal acute kidney injury, 25 to 35% of cases. Actual physical damage has occurred to the structures inside the kidneys. Acute tubular necrosis, the most common type of intrinsic injury, it is caused either by prolonged lack of oxygen ischemia from untreated pre-renal acute kidney injury or direct toxic exposure to nephrotoxins like IV contrast dye, certain antibiotics like aminoglycosides, or heavy metals. Acute interstitial nephritis, an inflammatory or allergic reaction inside the kidney tissue, most often triggered by medications like proton pump inhibitors, NADs, or penicillin. Glomerulonephritis, severe inflammation of the kidney's main filtration units, glomeruli, often due to autoimmune diseases like lupus or infection. Third, post-renal acute kidney injury, 5 to 10% of cases. A physical blockage in the urinary tract after the kidney prevents urine from draining. This backup of urine creates high pressure in the kidneys, shutting down the filtration ability. Prostate enlargement, benign prostatic hyperplasia, or prostate cancer in men. Kidney stones, bilateral stones blocking both uteruses, or a single stone blocking the ureter of a patient with only one functioning kidney. Tumours, cancers of the bladder, cervix, or colon pressing against the uterus. Staging of acute kidney injury. Medical professionals stage acute kidney injury using the KDIGO term, which translates to kidney disease improving global outcomes. It is based on two primary objective measurements: rise in serum creatinine and drop in urine output. Stage 1, mild. Creatinine increases by 1.5 to 1.9 times baseline, or urine output is less than 0.5 milliliters a kilogram an hour for 6 to 12 hours. Stage 2, moderate. Creatinine increases by 2 to 2.9 times baseline, or urine output is less than 0.5 milligrams a kilogram an hour for 12 hours or more. Stage 3, severe. Creatinine increases by 3 or more times baseline, or initiation of dialysis, or urine output is less than 0.3 of a milliliter kilogram an hour for 24 hours or more, or no urine for 12 hours or more. Symptoms and complications. Early stage acute kidney injury is often completely asymptomatic and detected only through routine blood tests when symptoms do develop. They reflect the buildup of fluids and metabolic waste. Decreased urine output or no urine output at all through some forms of acute kidney injury present with normal urine volumes. Fluid retention, swelling edema in the legs, ankles, feet or face. If fluid builds up in the lungs, pulmonary edema, it causes shortness of breath. Uremia, buildup, waste buildup, nausea, vomiting, severe fatigue, confusion, loss of appetite and metallic taste in the mouth. Chest pain or pressure caused by fluid overload or inflammation of the heart's linings. Key complications to watch for: hyperkalemia, hypotassium. The kidneys cannot excrete potassium. High levels can cause life-threatening cardiac arrhythmias, irregular heartbeats. Metabolic acidosis. The kidneys fail to excrete acids, lowering blood pH and disrupting cellular function. Uremic encephalopathy. Encephalopathy. I think I got that right. High levels of urea cross the blood-brain barrier, leading to extreme confusion, seizures, or coma. Diagnosis and treatment. To diagnose acute kidney injury and pinpoint its cause, doctors utilize a combination of tests. Blood tests, monitoring rapid rises in blood urea, nitrogen, and creatinine. Urinalysis, checking for protein, blood, or specific muddy brown casts, which point directly to acute tubular necrosis. Imaging and renal ultrasound is almost always performed to rule out post-renal obstruction showing swollen kidneys or hydronephrosis. Management strategies. Treatment depends entirely on resolving the underlying issues. First, volume management. For pre-renal acute kidney injury from dehydration, IV fluids are carefully given. For patients with fluid overload, diuretics are used. Second, medication review. Discontinuing any nephrotoxic drugs like NSAIDs or certain antibiotics and adjusting doses of other medications cleared by the kidneys. Third, electrolyte management. Giving medications like calcium gluconate, insulin, dextrose, or binding agents to quickly lower dangerous potassium levels. Fourth, renal replacement therapy, dialysis, used temporarily in severe stages of stage 3 to 5 when life-threatening complications like severe hyperkalemia, severe fluid overloaded, causing lung congestion, or uremic symptoms cannot be corrected with medication. Okay, everyone, that is summary of Category 2, acute kidney injury, all complete. I hope you like what I'm doing. If you do, please hit like, follow, and share. Helps to continue getting the story out there. And I'll see everyone again tomorrow to do complete summary of Category 3, chronic kidney disease. All right, bye.